My patient, Ata Muhammad, 50 years old, married, having 3 children, youngest of 12 years old, educated till middle. He is an ISI servant by profession and resident of Attak, admitted through OPD with complaint of aggravation of the already present skin lesions with formation of red raised lesions on the body since 2 to 4 months associated with itching. He was alright 10 to 12 years back when initially his disease started from elbow with a red papule formation, which was at that time associated with itching, which was moderate in intensity and associated with whitish color scales, adherent in nature, and upon itching, these lesions started to are associated with history of bleeding. They increased over the span of few months to involve the rest of the body surface areas, like predominantly extensors of the arms, legs and back, and also involved the abdomen, but there was relative sparing of the face and the flexures at that time. When the lesions healed, they left no inflammatory or depigmentary changes. Patient does not identify any disease aggravation or triggering factors like trauma, sunlight, seasonal variation, stress, drug intake, or any infection during the course of the illness. Patient gives history of disease improvement, partial disease improvement after applying topical medication. There is history of scalp involvement with the similar lesions, but no history of hair fall. There is no history of nail involvement like discoloration, thickening, or nail loss. History of involvement of palms and the soles is present. No history of any oral involvement, but history of genital mucosa involvement is present. During the course of the illness, there is no involvement of any generalized redness of the body with scaling, for which he needed hospital admissions. No history of pustular lesions on the body, and no history of lesions getting red, hot, tender with new lesions formation. History of joint involvement of right leg, right knee joint is present since the last 4 months. He feels difficulty in walking and doing daily life activities because of this pain, and there is no history of weight gain or blood pressure or any deranged labs like BSR, lipid profile, uric acid, and no history of oral ulcers associated with photosensitivity, no history of tense blister formations in the body, no history of depigmentary changes, depigmentary lesions or patchy hair loss. History of heat tolerance is present, however no history of weight gain or weight loss is present. No history of bloody diarrhea associated with dysuria is present. No history of painless genital lesion is present, and no history of prolonged fever associated with weight loss or lumps and bumps in the present. On systemic inquiry, dyspnea of grade 2 is present. He feels shortness of breath after climbing 1 flight of the stairs. History of palpitations off and on is present, but no history of pedal edema, and rest of the systemic inquiry is unremarkable. He has never taken any Hakim medication. He has always been taking treatment from the hospital setting, and he was given topical creams to apply, likely corticosteroids with emollients, with which disease gets partially improved. There is no history of atrophy or thinning of the skin or telangiectasias or increased hair growth after the application of these creams. A history of methotrexate intake is positive for 4 months, but the medication was stopped in the hospital setting after getting some labs, which he is unable to recall the reason of the deranged labs, and there is no history of any other systemic drug like retinoids, biologics, cyclosporin, and now he is being given phototherapy sessions thrice per weekly, likely narrowband UVB, and there is history of disease has waxing and waning course with multiple remissions in between, and 3 to 4 times hospital admissions with no identifiable triggers. He feels anxious in going outside and meeting with the peers due to this disease condition. Past history and family history is insignificant. He is Naswar intaker since 20 years, and he is the only bread earner of the family, and he feels quite difficulty in bearing his daily life expenses and treatment expenses. On examination, my patient is a middle-aged gentleman of average height and the build, sitting comfortably on bed, well oriented in time, place and person, well cooperated throughout the examination, with blood pressure of 130 by 90 millimeter of mercury, pulse rate of 88 per minute, respiration rate of 20 per minute, and temperature afebrile, temperature of 98 degree Fahrenheit. On general physical examination, there was no pallor, jaundice, cyanosis, clubbing, koilonychia, or pedal or sacral edema, and no lymph node enlargements in the body. And on cutaneous examination, there is a generalized involvement of the body with multiple well-demarcated erythematous scaly plaques predominantly present over the extensors of the arms, legs, a few on the back, abdomen, and with relative sparing of the flexures, face, and the scalp. There is a large plaque of 10 to 6 cm in size over the lower back with whitish scaling, which is semi-adherent in nature. There is no associated hair loss or atrophy noted around the lesions. Auspit sign was negative. Nails are shiny with a few pits noted in the fingernails and ridging present in the both fingernails and the toenails. There is onycholysis in the ring finger of the right hand, and subungual hyperkeratosis noted in the middle finger of the right hand. Body surface area involved is approximately 45%, and his PASI is 18.1%. And on the musculoskeletal examination, there is a normal range of the movement of the all joints with normal power and tone, and Faber and Schober test was negative. His waist hip ratio is less than 0.9, and waist circumference was 98 centimeter. And on systemic examination, there is normal vesicular breathing on both sides with no added breath sounds, and apex beat was in 5th intercostal space medial to the mid clavicular nerve with normal S1 and S2 and no added sound, and there was no hepatosplenomegaly or no other findings. Thank you.